Redox. So the Redox engine was designed to help startups, to help these entrepreneurs who are creating great new innovative products work more efficiently with health systems. This has been a big problem for the adoption of new technology within startups. So it was estimated last year that there were 100,000 healthcare applications on the market, and that number is expected to grow by 25% over the next few years. We're trying to help them get to market faster. So let's take a little example of what that might look like. Our friends over at SciAps, they're a technology company based out of San Francisco. They do analytics, and what they're able to do is take the genomic information, match it up with some information out of the electronic health record, and come up with ideas for better treatments for that patient and save lives. So it's a really big process that they're trying to come up with in a model to actually do that. We were fortunate enough to work with them to build this dotted line here, to build that interface between their first pilot customer, a large academic medical center, and their product. In doing that, we were able to help them prove that their product worked and start attracting more customers. But as they started to grow, as they attracted the next customer and the customer after that, they realized that that process of integrating with each health system wasn't just a one-time gig. This is something that every single customer that they brought on, they'd have to spend literally thousands of dollars and months of time in figuring out how to integrate with those products. So SciAps isn't alone in this space. Like I said, we have a lot of these applications that are sprouting up. And as the health systems get approached by more and more of these applications that are out there trying to do good in healthcare, they become overburdened. What we have here is an integration hurdle. The health systems themselves are overburdened. Their IT teams are trying to work with all these customers, and the applications themselves have to build these interfaces between them. The core problem here is that the language used to transmit data within a health system is something that's like ancient Greek to a modern application developer. And it's not only like ancient Greek, it's like ancient Greek in a number of different dialects, because as you move between one health system to another, that dialect changes subtly. So this is how we solve that problem. We put a white box in the middle of this diagram, and we call that Redox. Redox is an engine that allows us to tell the application developers to send us information using JSON, using web services, things that they're comfortable with, things that they know how to do. We translate that into HL7, the language and the correct dialect for each of these health systems. In doing that, we break down these barriers of integration. We do it while allowing that startup to scale faster, and we also do that while reducing the burden for the health system. So I want to introduce my team here really quick, because James is in the audience. He's sitting back here, so he can answer your technical questions. He worked at Epic for 6 years on pretty much every technical team they have, and did this professionally with them. I was at Epic for about 3 years and kind of worked within business development. And since then, we've been working in the health IT space, trying to help people get to market. So I'm not sure what healthcare is going to look like 5-10 years from now, but I hope it'll be more efficient. I hope it'll deliver a higher quality of care, and I hope that it'll do it in a way that's more cost effective. With Redox, we're trying to help these innovators get there faster. Thank you.